Hello friends, I am Dr. Sunil Saini, trauma surgeon, expert in limb lengthening, deformity correction, pain management. Today we have another patient, Mr. Krishna. He is from Gujarat and he is suffering from chronic lower backache with both lower limb radiculopathy. Along with that, he is also having weakness in his left lower limb. He is also having difficulty in holding the slippers and there is a chronic pain and he is suffering from this problem from last 1 year. Also the tingling and numbness is now reaching up to the chest. If you see his MRI, the MRI has not so significant issues, but there is a disc bulge out at L4 and L5. There are many cases in which the MRI is not so saying so much of problems, but the patient's symptoms are very severe. He is not able to walk, he cannot stand prolonged, he cannot sit for prolonged because he developed very severe back pain and stiffness. Now if you see his neurological status, can you lift this leg? इसको ऊपर उठाइए सीधा, जहाँ खिंचाव लगे रुकना है आपका. So we are checking his SLRT. जहाँ खिंचाव लगे बताइए, यहाँ से है. इसको ऐसे खींचने दर्द बढ़ रहा है. नाउ यू कैन सी ही इज जस्ट क्रिंचिंग इन पेन. बहुत बढ़ गया. सो एडी पे ठीक है. सो दिस इज हिज SLR विच इज ऑलमोस्ट 50. नाउ गो दिस ऊपर उठाइए जहाँ पे खिंचाव लगे रुकिए. यहाँ पे स्टार्ट हो गया. सो इट्स 40 बढ़ रहा है. ओके ये सब दर्द रहता है. नाउ यू चेक, वी आर जस्ट सीइंग हिज पावर. इसको पुल करिए. सो एंकल डोर्सिफ्लेक्शन इज वीक. सो एंकल डोर्सिफ इधर कमजोर है, चप्पल निकलता है और एंकल डोर्सिफ्लेक्शन इज वीक. पुल करिए, खींचिए साइड्स. नाउ विल सी हिज EDL एक्सटेंसर डिजिटल लॉन्ग. इसको खींचिए. सो यू कैन सी दिस इज वीक एंड इसको खींचिए. सो extensor distal longus as well as EHL is weak. That's why he is not able to hold his slippers. So what we are doing, we are going for intradiscal ozone nucleolysis plus facet blocks plus DSCB injections in tau, as well as we will go for beta 1, 2, 3, 4, 5 and we'll see the results how his like weakness which is there will improve. We have seen many patients in which even foot drop has improved. Patient is coming at like early stage, if patient is coming in early stage. So the whole procedure will be done in the same pattern. Patient will be in the prone position. We will put the local anesthesia. Our anesthesia team is on standby. And then we will go intradiscal at L4 and L5 level. So friends, the patient is in prone position. We have done this procedure under local anesthesia and we have gone at 2 levels. Come here. Now this is L4 level and this is L5 level, and we can see here in L5 level, because the disc space is very much reduced, we are not going inside. We will go more inside now. Now you can see here on the screen, this is L4 and L5 disc, and this is our needle, and we have injected some dye to confirm that we are in the disc only. Now this is one which in between L5 and S1. Now we will proceed further and then we will inject the ozone. So whenever we are inside this, we go and confirm with the help of the dye, and then we inject ozone, which acts as anti-inflammatory, analgesic. It's even increase oxygenation to the tissues. Even people are saying that they are doing research on this, that even it can help in regrowth of the disc and also increase the flexibility of the disc. But definitely it improves a lot of things, and especially pain, inflammation, this gone off. And if patient is having canal stenosis, then also the ozone will help in reducing that inflammation and the canal can open out. And along with that, we will go for DSCB injection. Everything is ready. We are going for ozone now. So before giving ozone, we have already injected some local anesthesia at the disc so that there is no painful. Now I am just injecting the ozone. So 3 to 5 cc of ozone is more than sufficient. You can see here, this is the whitish structure which you are seeing now. This is the ozone which we have injected. You can see some white line is going through. Now I am at the facet joint. Now I will inject at the facet joint also, and similarly we will repeat the procedure at L5 and S1 level also. This is how we do go for ozone nucleolysis. Along with that, we'll augment this with the help of DSCB injection or physiological pain portal, so that we can maximum benefit. So nowadays, even every portal blocks we are injecting ozone and hydrogen also. That is called hydrozone portals now. So now I am going to inject at the facet area. So patient is totally comfortable. Now we will repeat the same procedure at L5 and S1 level. And then we will go for the DSCB injection. So friends, we have given tau blocks, we have given intradiscal ozone nucleolysis has been done. We have given injection of ozone around the facet also. Now we are going for physiological pain portal, also called DSCB injection, beta 1, 2, 3, 4. So patient is in prone position. I will give 2 from this position, and then I will make the patient in supine position and will give rest of the injection, that is beta 4 and beta 1, 2, 3 from front. This is how we treat such kind of patient, and 85 to 95% of the patient can be treated without any surgical intervention. So any patient who is suffering from disc prolapse, significant disc prolapse with sciatica problems, cervical spondylosis, tennis elbow, frozen shoulders, all these things can be very well treated without any surgical interventions. And more than 95% of the patients who are young patients suffering from single level of the disc with the compression with sciatica, more than 95% of the patient can be very well treated with the help of intradiscal ozone and DSCB injection. Even there are articles, there are papers published which have compared the result of ozone versus endoscopic, and both results are similar. Then why you need to go for any surgical intervention? That's the thing which always keep on running in the patient's mind, that doctor is advised to go for surgical intervention. I didn't want to go for surgical intervention. So it's a good news for you that more than 95% of such cases can be very well treated without any surgical intervention. So if you, any one of your family members are suffering from such kind of conditions, you can contact on the below number. Thank you so much.